Good morning, everyone.
Morning, Tom.
Morning.
Beautiful foggy morning here.
Yes.
Yeah. Morning, commissioners. So we are set to go at 8:30, Madam Chair, and you have your collection of commissioners.
Okay. Well, good morning, everyone, and welcome to the Tuesday, October 12th, 2021, Washington County Board of Commissioners work session. Later this afternoon, we'll be having a joint meeting with the Washington County Fair Board. So this is Catherine Harrington, Chair of the Washington County Board of Commissioners. And with me this morning is Commissioner Roy Rogers, Commissioner Jerry Willey, Commissioner Nafisa Fye, and Commissioner Pam Treese. Okay, first item on the agenda is board and leadership communication. Which of the district commissioners would like to go first? Oh boy, they're all just raring to go. Go ahead, Commissioner Willey.
Oh, I thought I saw Pam raise her hand, but I'll go ahead.
You bet.
Yeah, last week was an interesting week of different kinds of meetings. So it was always educational. We had a special Northwest Act meeting last week that was actually over the lunch hour, but on our Tuesday meeting. So it kind of filled in the spot there. Senator Johnson had asked us as an organization, Northwest Act, to submit some priorities. So we had done that. If you remember, we sent a letter of support a while back for Staley's Junction, and Staley's Junction is on Highway 26 heading towards the coast, just past where Highway 47 comes in. And that intersection has 2 or 3 projects actually that we have been looking at for a number of years, but we had supported Staley's Junction. Other Columbia County was supportive of some Cornelius Pass from Highway 26 to Highway 30 improvements. Of course, the regional solutions team are still very supportive of the Salmonberry Trail. And then Highway 6, I think I've reported this before, Highway 6 has some significant issues with it. Specifically, a section of it that continually tries to slide into the canyon, and ODOT has spent millions and millions of dollars of trying to, of course, fix that, and so far that hasn't worked. Don't worry, you're not going to slide into the canyon as you go across that section, but it's certainly a serious issue that we're going to have to address on Highway 6. I met with the Hillsborough City Council last Tuesday night, gave them an update on the ESPD that we had talked about previously. And certainly Project Turnkey was a topic that they were interested in, and then let them know about the tobacco ordinance. And Representative McLean was on just before me. So it was a good 30 minutes plus of information, both from legislature, from McLean, and from certainly Washington County. So they got updated on a number of issues. Of course, we all attended the Senator Merkley meeting, and I thought that was a very good meeting. And I was able to communicate again the priority of broadband, certainly for our county, as well as the rural western side of Washington County, and kind of give him an update. And then on Friday was the Forest Trust Lands meeting that was very informative as well. We are talking about the Forest Management Plan and the Habitat Conservation Plan, but this was pretty much specifically about the Forest Management Plan and the definition of the greatest permanent value. And that is going to be an ongoing dialogue, because there is some, I will call it confusion or conflict between what certainly the county's county commissioners have determined as the greatest permanent value, and how it compares to the 1997 rendition of the greatest permanent value. And so it is going to get very complex. Catherine, I think you set in on that meeting as well. And so if you certainly I'd appreciate your insights on that. But there has been chair of the Forest Trust Lands is Commissioner Yamamoto from Tillamook. He provided us all with some research that they had done. And so I will certainly be glad to provide that to you, each one of you, if you would like to have more updates on that. Like I said, this is a very complex issue, so stay tuned. The dialogue will continue, I believe, for a long time.
The one correction I would make to your representation of this board to that committee is that we did review greatest permanent value in 2020 and reaffirmed our support for the greatest permanent value definition that the Department of Forestry is advancing. We all have that letter that we sent to the Oregon Board of Forestry. You'd mentioned in your comments that the Washington County Board of Commissioners had not pursued the topic since 2013, and that wasn't quite accurate. So,
well, that is true. I understand that. And we did send a letter of support of the greatest permanent value in 2020 as a commission. But it has yet, to me, not been defined clearly as to what that definition actually is. And so we can say we support greatest permanent value, just like I do. And I believe that the Forest Trust Lands commissioners all do as well. Now, the question is, what exactly does that mean? So
we went over the current definition of it when we had our time with the Board of Forestry back in that June meeting. So anyway, we can move on.
Well, there's again, the Forest Trust Lands doesn't agree with the Board of Forestry. So the Board of Forestry was in this meeting. It was a good dialogue.
I was
and
there.
Everybody listened. So I know. So, okay. I know that I didn't make JPAC last week, but I think Commissioner Fye, did you attend that? I had heard that you were going to do that. I didn't know if you actually did or not. I'm not meaning to put you on the spot there. Just if you did go to that, would you kind of give us an update? And other than that, that's all I've got. Thank you.
As our rep to JPEC, I'm sure she will. Commissioner Terrace, go ahead.
I can go next. Thank you.
Pam, just I didn't mean JPAC. I meant JCPAC.
She and I each attended that meeting. Yes.
Okay, I just didn't want you to confuse it with JPAC because she always reports on that. So anyway, I just want to make sure I was clear.
So first of all, I want to say thank you to all of you for supporting me during the loss of my mother. It was unfortunate that it happened right in a county board meeting, but I really appreciate the support at a friendship level and also at a board level. So thank you very much for that. So it was a little bit of a slow week for me, but it seemed like I caught up yesterday. It was AOC all day for me by Zoom. I know the chair was down in Salem at the meetings. I attended the natural resources meeting in the morning, and the big issue there was the discussion around the River Democracy Act, and basically AOC in the Natural Resources Committee decided not to take action on that. So that is consistent, I believe, with what our philosophy is there. So that's good. The legislative meeting, and I'll just give a quick overview because I know that Catherine was at both meetings as well. I think the issue that we're facing right now, the biggest issue at AOC, is how do we, as a body, agree to support issues as they move forward. And it's an ongoing kind of a debate as to whether we had this presentation at the District 8 meeting. Do we need 48 hours of awareness or notification that something is a letter of support or something is coming forward? and also what degree of support overall through the AOC body do we want? Is it somewhere around 67% all the way up to 90%? So those are the discussions that are going on right now. And I would characterize the discussions really are around making sure that AOC speaks with one voice, and that we tend to have a split on some pretty significant issues. And when we see that dramatic split, how are we dealing with it? That's the gist of this. And I also attended the board meeting in later in the afternoon. And then just as a reminder, the AOC fall conference is November, I think it starts November 18th and goes through the 20th. And I'll be down at that as well as the chair. And I'm not sure, I think Commissioner Fye is going to be attending, and I'm not sure about the others. So I just wanted to give you that update. I also have a Central Cultural meeting on Wednesday of this week in the evening. So that's it for me.
Commissioner Rogers or Commissioner Fye, how about you?
The only thing I think that might be important is a meeting that Commissioner Fye and I had with Convene the housing group the other day. One of the things that I've mentioned before in board meetings is that it's getting very complicated with additional housing dollars, financing arrangements, just the array of issues. And one of the concerns that I had, and I know Nafisa probably had them as well, is how many more of these projects do we have that are expiring in terms of their status as properties that are subject to agreements on maintaining affordable housing rent levels. And you all got a copy of it. I think that's good information. I don't want to speak for you, Nafisa, but you can speak in a moment. But we both felt, I think, that this needs to be addressed. We need to spend some real time, because this is just the tip of the iceberg on what we might be seeing. These projects were designed with a 30-year life, and I know newer ones have longer lives, but no one thought back in our early days that we would have these long periods of time that people would need these particular facilities. And so that might be short-sighted on those of us who were on the board before, but we thought that was a long period of time. And those are now coming up for renewal. And unless Comey has found a bunch of money in the last 5 or 6 days, we really don't have the resources to do what we need to do on the number of facilities that are impacted. So that's probably the major one. I agree that it was nice to talk to our good senator. I guess we got another senator meeting this week, and Ron's been there a long time. Always nice to see him and chat about issues. He's very, very well informed. So that's later. And today we've got our fair board meeting, and it's good to hear what's going on. Though Jerry probably could do that in 10 minutes by himself, since he serves on that committee. But it's always fascinating to me on an enterprise fund like that, whether or not things are going well. So I will turn it over to Commissioner Fye.
Good morning, Chair Harrington and Commissioners. Thank you, Commissioner Rogers. I really enjoyed having that meeting with you, with Comey. And I'll just let the board know Commissioner Rogers tested me on some definitions, and I had to chase and ended up actually reading an article on arbitrage from Harvard. So it was actually a good meeting and interesting topic, and look forward to having more conversations on that. My last week was, I had to take some personal days last week, so it was pretty light. But the highlight of some of my meetings last week was, it was interesting to hear. I had a meeting with Kristen with Pride Disposal. So it was interesting to hear the holistic perspective and sort of what they're doing on their end in terms of next steps to serve, to provide more recycling services to the unincorporated areas of Washington County. And actually, they've been meeting with a lot of cities to also have that conversation. So that was interesting and good conversation. I've had, I think Commissioner, really, when you said JPAC, I was thinking the same thing of Chair Harrington, and I was going to tell you that's next week, but I do see you meant JCPAC. No, it's just a bit confusing, and I think Chair Harrington is the alternate on that committee. I did attend and did a lot of listening and learning on that. Was my first, and I want to really extend my appreciation to Chair Harrington for making sure that we're included in that meeting and we got the agenda. So it was really good meeting, a packed agenda. So other than that, the other thing I attended was our CPO meeting and this month, which is always the first of the month. And that was really good. We're doing a town hall for District 1 with ESPD. Oh my gosh, I'm having a hard time saying the acronyms this morning. But we're doing a public safety and really focusing on the ESPD part of public safety to get the word out and to engage and see what questions people have in terms of that. And then, yeah, I think that was my week. I say pretty light. This week is really packed. So thank you, Brenda. We're making up.
Well, surprise, it's the middle of October. And as Dr. Fauci would say, kids, head out trick-or-treating. Everybody have fun this Halloween season. And yes, time marches by very quickly. Last week, I, along with Commissioner Faya on Thursday, attended the JCPAC meeting on juvenile justice. There was some 2020 data that was reviewed, and then they're pursuing some additional grant opportunities. Just a really great collection of folks throughout Washington County who collaborate to try and ensure that our youth who venture off into some difficult areas have support, mentoring, and guidance supervision to get them on a more productive path to adulthood. Because like it or not, we all become adults at some point in time. On Friday, as Commissioner Willie mentioned, I listened in on the FTLAC meeting. And yesterday, I really appreciated Commissioner Terrace covering the Natural Resources Steering Committee. There was a bunch of activity late last week to try and make sure that all commissioners across the state had the benefit of good information about the River Democracy Act. If I represented that title correctly. Then in the afternoon, we had a somewhat short legislative committee meeting. We did get a short review from Jody Christensen from Regional Solutions. Wasn't really very in depth. It was about House Bill 5006 project. Then we were introduced to a new member of the AOC legislative team, a name that may be familiar to some of us, Drenda Howitt, who had previously worked with Clackamas County. Her portfolio will include natural resources and veteran services. Commissioner Terrace mentioned the big ticket items that were discussed in the board meeting versus the ledge meeting. And that was over the bylaws proposal that was reviewed at the various district meetings. We went over that summary information and a a refined proposal will be advanced at the conference for full membership, such that each steering committee will need, the proposal would require that topics through the agenda be posted 48 hours before the steering committee meeting, as well as in order for positions to be taken, at least 75% of the membership would need to be in support. And there will be some additional data provided to us about how some past issues that some have felt were divisive came about with different thresholds. So that's the long and short of it. We had pretty long discussion about that. AOC is now in a full ownership of a hard asset in the form of the newly purchased building across the street, so new headquarters for AOC, and the team is working on the transition occupant plan for that. So the conference officially starts on Tuesday, November 16th, and runs through Thursday, November 18th. But there's also a meeting on Monday, late afternoon and evening for the women of AOC, all the female commissioners, women commissioners across the state will be gathering the night before. So that's the long and short of it. So.
Thank you for that correction. I knew I had one date right. I just didn't know if it was at the beginning or the end. Thank you.
I didn't want Janet thinking that all of a sudden she needed to change hotel stays. So I know we have some letters to go over, but Commissioner Willie and Commissioner Fye, you each have something you want to add.
Just the fact that it's unfortunate that the AOC always has their conference during that time of November. I, every year annually, leave on vacation on November 15th or November 16th, depending on what the airlines dictate. This year, I am leaving on the 15th, and so I will miss that AOC conference once again. But I trust I will get updated from the commissioners that do attend. So thank you.
Oh, and I forgot to mention that we don't have the information yet, but we were given the heads up yesterday that the dates of the various steering committees will be changing for 2022. It sounds like only Ledge and Board would happen on Mondays. Right now we have Veterans, I think, happens on a Wednesday, Health and Human Services on a Thursday, and then Governance, Revenue, Natural Resources meets on Monday, as does Public Safety. But looks like the full membership has really enjoyed having all the steering committee meetings be at their own distinct times, such that through the hybrid meeting and virtual meeting environment, more commissioners have been able to attend different steering committee meetings. So AOC staff will be finalizing that, and I hope that we'll get information on that at the conference. So, Commissioner Fye.
Thank you, Chair Harrington. I forgot two other highlights from my last week. I had a great meeting with the new executive director for Family Justice Center, and Rachel Schultz. And I wanted to extend my thanks to that. And then I also had a great meeting with the Regional Arts and Culture Council, I think it's called RAC. And that was a really good meeting because I think they were concerned about some of their budget, I think anticipating future budget cuts, but it was really great good meeting to learn about some of the things that they do and how they support art and culture in Washington County. I just wanted to not leave them out. Those two.
There was also a fun fact on the AOC Board of Directors meeting that I didn't know until we had the item discussion. I'd read the packet, but had missed the fact that there is a project where AOC has served as the project manager for an effort to combat sudden oak death disease. In Oregon, this disease is only known to exist in Curry County right now. And so we have a vested interest, given that we have a lot of oak trees further up the valley, in ensuring that that project continues to go well. So there was a new IGA approved to continue that work and continue to combat this disease so that it doesn't propagate further and destroy our iconic Oregon white oak. So we'll see what happens. So, okay. Should we do the letters first or as part of leadership communication? What would you like, Ms. Angie?
I plan to do them as part of leadership communication.
Terrific. So take it away, please.
Okay. So I wanted to let the board know that this week we're getting out public messaging about our transition to a new public emergency warning system. The county has had a reverse 911 style warning system in place for several years, and it's been called Code Red. This last year, the state legislature funded a statewide warning system, and the state enterprise services selected Everbridge as a provider. This is a common platform actually used across the county. So right now we're in the process of transitioning community members from the current system to the new system, and we'll continue to push out messaging throughout the month to get new community members signed up for Everbridge. Sure.
Related to that, can we make sure that there's an easy to find way on our website for people to unsubscribe? Mm-hmm. The cell phone number that I have as assigned for work, I continue to get emergency phone calls from Austin, Texas. And it happened again this morning. It was pretty much quite an experience when Texas was having ice storms and power problems this past winter. My phone was going off the hook. It was incredible. So we need to make sure it's as easy to unsubscribe as it is to enroll.
Point taken. Kind of a timely update given your experience this morning, Ben. Relative to our employees and COVID, we do have 6 employees that are off work in isolation after being tested for COVID-19. And we have 6 employees who are unvaccinated who are in quarantine after being a close contact. 3 employees who are vaccinated and asymptomatic are still able to report to work. So that week over week, we are staying stable still with our case count. And with that, Clerk Moss, if you could promote Matt Craigie and Stephen Roberts, and we can walk through the 3 letters that are included in the board's packet. And Chair, do you want to take them in order?
All right. Well, good morning, Board. Stephen Roberts, Director of Land Use and Transportation. I've got one draft letter for you to consider this morning to the Tigard City Council. This is a follow-up from your board briefing a week ago regarding the River Terrace 2.0 concept plan work that the city has done there. And we are suggesting that the board would support providing transportation service to that new urban growth boundary expansion area, and have listed a set of conditions, we're calling them, for lack of a better word, just that would help guide future work there to help ensure that a few things that are key to the county will be considered as the growth boundary expansion work moves forward, should Metro approve it later this year. And with that.
So commissioners, do you have any questions or comments on the letter? Seeing none.
Just quick comment, and that Stephen, thank you for clarifying that is so important, that tile flat extension, and I think you really clarified it very nicely. I don't know what all that's going to cost, but without that, it's my belief, without that particular facility, there's no way to make this work effectively in that area. So you did a nice job.
Thank you.
Seeing none, is everyone thumbs up in approval of the letter? Okay, you got it.
Thank you.
On to the next two letters that come to us via work from our Economic Development Manager, Matt Craigie. One for a GPI project and the other for a University of Oregon project. Take it away, Matt.
Great. Thank you, Chair Harrington, and good morning, Board of Commissioners. For the record, my name is Matt Craigie, the Washington County's Economic Development Manager. So 2 letters of support for your consideration this morning. Both of these are in support of grant applications for the Economic Development Administration's Build Back Better grant. So we're trying to support bringing some more ARPA dollars to our region and to Washington County. So let me just briefly give you an outline of the program and of the 2 grant applications. So under the American Rescue Plan Act, the EDA has launched a series of grant opportunities for local governments to spur innovation and economic growth. The application deadlines are staggered over the next year. The most immediate deadline is, and one of the most robust grants available, is the Build Back Better grant. This is a 2-phase grant that will award 50 to 60 regions across the U.S. with up to $500,000 for a preliminary implementation planning phase. Phase 1 awardees will be eligible for a Phase 2 funding round in the spring of 2022, which will award between $25 to $100 million in an identified coalition project. So this is the opportunity to bring a lot of money to regions across the United States. So each of these, there's 2 efforts that are going on here in our region, and that I'd like to propose that we be a part of. And so the first one is Greater Portland Inc.'s Build Back Better grant application. So in our region, yes.
Those letters were sent to us, so we need to be brief during this. So commissioners, do you have any questions or comments on the letter? Okay, is everyone all set on the GPI letter? Okay, now for the University of Oregon letter, we've had that to review as well. Do you have any questions or comments on that letter?
I have a couple of brief ones because I guess I don't fully understand. I understand it's good regionally to do these things in the valley. The reasons given for lack of maybe robust development, it didn't seem to address the lack of inventory that we have here in Washington County. We don't have any large industrial sites. That's one issue. The other issue, there was no mention at all of tax implications. I mean, it's cheaper to develop in Eugene than it is in metropolitan area, but are we just hanging together as a group and really this doesn't benefit us? Or I'm trying to, does this hurt the GPI effort by having 2 requests? Maybe the answer is no. I just don't see this Eugene one helping us a whole lot, but that was my take from the read.
Thank you for the question, Commissioner Rogers. The University of Oregon's proposal is about coalition building, and it's about supporting an emergent industry cluster here in Oregon, stretching from from Clark County, right, and our neighbors to the north, all the way down to Eugene. So other regions such as San Francisco and Boston have very strong bioscience and bio manufacturing areas. We think that we can compete with those areas by making stronger connections between our premier university systems and some investments by private industry, and by leaning into developing the workforce system to make sure that there's more folks here in Oregon that can move into the bioscience field.
Are there any other questions or comments?
I just want to say I'm very much in favor of this, and the whole concept of a corridor really makes us more competitive across the nation.
How are folks on the letter? Okay. Thank you, Matt, for pursuing these opportunities in partnership with others.
Thank you.
What else have you got, Ms. Angie?
That concludes my update.
Okay. How about you, Mr. Carr?
Morning, Chair and Commissioners. I have nothing to add. Thank you so much.
Ms. Taniguchi Dennis, Clean Water Services.
Good morning, and thank you, Chair Harrington and Board of Clean Water Services. I first want to start off that the team at Clean Water Services extends our deepest condolences to Commissioner Terrace and Commissioner Fye. It's been a tough week for everybody, so thank you, and we're all thinking about you. We're looking forward to the board learning sessions next Monday, Wednesday, and Thursday. The team is very excited to share with the board what's been going on at Clean Water Services and the things that they're doing to prepare for the future. The agenda was delivered electronically, I believe, to the board last Thursday. There are two things I want to highlight. So during the time with us, the 2021 Great Oregon Shakeout is occurring on Thursday, the 21st, during our training session. So you'll get to experience that with the team, and they would like to also share with you our earthquake preparedness that they're working on. Also, that Jess from our team will be taking photos. So I just wanted to let you all know that, and so it won't be a surprise that she'll be there.
Which days? All three?
All three, yeah. So she'll just kind of be in and out, and it's just some really great an opportunity with the board and with staff. We're also pleased to announce that Jack Liang has been selected to serve as our first Chief Strategy Officer, and that Tanya and I worked out during a transition period to their new CFO that Jack will continue to provide CFO duties and support to the team at Washington County with an IGA. On the COVID front, we have one positive case with an employee. They're currently on vacation, unfortunately, when they became ill, but we also have no new additional exposures with the team, and they're preparing for the cold weather. We got a little bit of taste of it the other night and early morning, so it's clearly a transition towards the fall. So, but the team is doing well, and we're looking forward to our time with you next week. So thank you.
Thank you. I've had an emerging issue come up through the Tri-County chair, so sorry, I was only half listening to all of that. Okay, anything else from commissioners? Okay, seeing none, we'll move on to our next topic then. Update and discussion of Washington County Ordinance 878. I'd like to turn it over to Ms. Marnie Kyle and Tom Carr.
And while we're waiting for Marnie to come on, may I just set the procedural posture to remind you where you are in the process. You've had first reading on Ordinance 878. Second reading is scheduled for October 19th. Commissioner Fye and Chair Harrington have proposed amendments. Those amendments are available for discussion. You cannot act on the amendments today at a work session. The action will occur and the discussion about those amendments in depth will occur in the vote on October 19th. If you choose to amend the ordinance on October 19th, and to be clear, the ordinance going forward on October 19th now is the ordinance that you had first reading on. So the second reading will be the same ordinance. If you choose to amend it on October 19th, a third reading will be required and a second public hearing on the engrossed ordinance with whatever amendment the commission approves. And I would now turn it over to Marnie Kyle.
Great. Thank you, Tom. Thanks for the overview. Good morning, Chair Harrington and Board. I'm Marnie Kyle, the Director of Health and Human Services. And I just have the honor today of really introducing folks. But I wanted to start with a really quick thank you. So I really want to thank Gwen, as well as her backup team, Pewson and Marie, for pulling this work together. This has been really interesting process. And I wanted to let you know that Gwen has really worked hard to incorporate everybody's suggestions. She and I have talked with many of you. We've done our best to answer and address all of your questions. And as always, public health is bringing to you evidence-based best practices. So I wanted to really say thank you to Gwen, because this has been a really busy time for her, because she's also working with OHA on implementing TRL in her other job. So I also wanted to say thank you to the board, because you all have been exploring this with true curiosity, interest, and openness. Some of you have even been making site visits. You've been doing a lot of research on your own. You've been asking really important, good questions, and you're listening to the science. So I just really want to say thank you to you all for engaging, as you always do when you're making really important, long-lasting decisions that will impact the health of our community moving forward. So with that, I'm going to turn it over to Gwen, and Latricia Tillman has also joined us as a presenter. So thank you, Latricia, for supporting this effort as well. And I just wanted to give you a heads up that Gwen has to leave at 10. So if you happen to still be deliberating, I will do my best to collect the information and make sure she's aware of it before October 19th. She's presenting at OPHI today at 10 o'clock. So with that, I will turn it right over to Gwen.
Great. Thank you so much, Marnie. So again, thank you to Chair Harrington and all the commissioners for allowing me to speak more about this topic today. Again, I'm Gwen Ashton. I'm the Tobacco Prevention Coordinator with Washington County Public Health. And then I have with me Latricia Tillman, our Chief Equity and Inclusion Officer as well. Next slide. Okay, so just a quick overview of what we're going to be talking about today. We're of course going to do a quick history and Senate Bill 587 overview, talk about those protective strategies, price promotion and discounts and flavors, a little bit on the retail environment, some national trends, and what we have learned. Next slide. So in 2017, Oregon raised the purchasing age for tobacco products from 18 to 21, and this was a huge step because we know that most smokers, 90% actually, start before the age of 21 or by the age of 18. So lengthening that time from onset is really important. And in 2019, we spent time with the board discussing what we can do at the local level to reduce youth access and tobacco addiction in our communities. And at that time, Oregon was just one of 9 states that did not have tobacco retail licensure. That's unlike what's in place for cannabis and alcohol. So we presented data illustrating the rise of vaping among our youth and the concerns associated with this relatively new product at that time, and the limited research in regard to the long-term health effects. And lastly, we spoke with the board to update the existing ordinance to make the language current and include additional protective strategies. So while the board,
I don't know if your mic is covered up, if your laptop is closed or something, but it sounds a little bit like you're talking underwater and it comes in and out.
Okay. I don't know how to change that.
Okay, well, we'll just keep going then.
I'm sorry about that. I don't have, I'm trying to see.
Is your laptop open?
I'm using a mic actually on my monitor.
Okay.
Yeah, so it should be working.
Okay.
That's unusual, yeah, and I can't change it from where I'm at right now.
Okie dokie.
I'm sorry about that. So we'll hopefully, maybe I'll try to get a little closer to the mic. Is that helpful at all? Maybe not. Okay.
Sorry to interrupt your flow.
No problem. I'm going to change the audio settings. Let me see.
Really, it's okay. Just keep going.
Is this better?
Just keep going. We know you have a 10 o'clock.
Okay. So while the board was very supportive of our work at that time, we were ready to move forward, and then we faced challenges of COVID. So the work went on to pause, and then we switched our needs to addressing the pandemic. But prior to the pandemic, we were engaging cities in conversations around a tobacco retail licensing program for Washington County, and we were gauging their level of support in joining us on that effort. So during this past legislative session, you can go ahead and switch slides. We saw some advancement in tobacco prevention. So we were able to raise the tobacco tax, and that included a tax on vape, which hadn't been taxed previously. And Oregon also banned the online sale of vape products. And the biggest change of all was Oregon will now have statewide tobacco retail licensure, also known as TRL. And that's expected to go into effect January of 2022. And this means that there will now be statewide requirements for businesses that sell these products. And OHA will be the licensed insurer, and local authorities will be able to administer and enforce TRL, provide education and outreach, and add protective strategies as well as civil penalties. Additional fees, we will need additional fees to cover the costs due to size of our county. The fee that is assessed by the Department of Revenue will only cover the license itself. So we will have additional fees to do inspections, education, and enforcement. Okay, next slide. So what can we do? We are allowed to have additional protective strategies at the local level. So this is prohibit price promotions and discounts and flavor restrictions. The tobacco industry channels more advertising and discounts into neighborhoods with high proportions of residents who are people of color or have low socioeconomic status. The prevalence of tobacco make it easier and cheaper for residents to start and continue using these addictive products. By strengthening the state TRL, we have an opportunity to alter the systems and policies that perpetuate inequity by replacing them with new policies that purposefully lead to health and equity. We can do this by prohibiting price promotions and discounts and by restricting flavors to establishments that only serve people who are 21 years or older. Next slide. So we know what we said before is we know that tobacco retail is clustered in neighborhoods with a high percentage of low-income residents or residents of color. And these communities are specifically targeted by the tobacco industry, and they disproportionately suffer the health harms caused by tobacco use. The tobacco industry has long used the point of sale to target consumers, not just based on their race, ethnicity, and income, but on their mental health, status, gender, and sexual orientation as well. Youth and young adults are more price sensitive than older adults. So lower prices encourage youth to initiate tobacco use, and along with coupons and other price discounts, encourage youth to move from experimentation to regular smoking. So according to the research, for every 10% increase in the price of cigarettes, adult smoking decreases by 3 to 5%, and youth smoking decreases by 6 to 7%. So the tobacco industry knows that cheap prices help to lure new users and keep current users hooked. So they spend billions of dollars each year on price discounts and coupons to reduce prices. Studies have found that people who purchase discount brands or use coupons make fewer attempts to quit tobacco and are less likely to reduce their tobacco consumption. In fact, research has estimated that smoking rates would drop by 13% if price promotions were prohibited nationwide. Next slide, please. So the tobacco industry focuses on the point of sale by giving retailer incentives or merchandising programs, which are often in contracts or other merchandising agreements with retailers. These contracts allow tobacco to secure the best display space, which is usually at the end of the aisle, at eye level, or on a countertop. They also get to decide the amount of advertising and products to be displayed and establish price and promotional incentive programs. These contracts motivate retailers to display, promote, and advertise tobacco products, keep tobacco product prices low, and keep the convenience stores dependent on the tobacco industry. Seeing tobacco products in all the marketing in stores creates the norm that tobacco use is common and accepted. Knowing all of this, the Surgeon General supports comprehensive tobacco control, such as local ordinances that regulate tobacco sales and reduce youth exposure to retail tobacco marketing as a legitimate, necessary, and effective way to prevent youth tobacco use. And as this slide highlights, 95% of tobacco marketing appears in the retail environment. Next slide, please. So flavored products, who is using them? As the slide highlights, we are saying it's our young people. This data is reflective of those who reported using a flavored product. And it's from the Oregon Healthy Teens and the Behavioral Risk Factor Surveillance System data. So currently there are over 15,000 flavors on the market, and that list continues to grow. Flavors mask the natural harshness and taste of tobacco, making flavored tobacco products easier to use and increasing their appeal. The combination of nicotine and flavoring with candy flavor names like bubblegum, strawberry, tropical fusion, and grape targets young people and contributes to smoking rate and nicotine addiction at an earlier age. And research has shown that youth are more likely to start with a flavored product. And that's what we often see in this data from Oregon Healthy Teens, is in fact they are using a flavored product. And it's alarming how many of them under the age of 18 are doing just that. Next slide. And what about in Washington County? So this is going to focus a little bit more on the flavored e-cigarettes, but this is also from the 2019 Oregon Healthy Teen Survey. So we've seen that 9% of our 8th graders are currently using an e-cigarette of some type, so some type of vaping device. And 18% of 11th graders are also using this product. And we say using, that means on a regular basis. So this is, they reported they are using these products. Next slide. Okay, so what is menthol? So this is a flavor I wanted to highlight because there's been some questions around menthol in particular. When we're talking about flavor restrictions, we are including all flavored products, which include menthol, cherry, chew, little grape cigarillo. So not just vaping products, but all flavored products of tobacco. So what is menthol and why do we care about menthol? Menthol was introduced in the 1920s, 1930s, and it was actually the first product to be advertised as a healthier option. And I think we've heard healthier options before from vaping industry when that product first came out. Menthol was the first one to adopt that term. So unlike other flavors, menthol cigarettes have antiseptic properties. So it masks the abrasiveness of the tobacco smoke, cools and numbs the throat, enables the users to inhale more deeply, and that increases their exposure to all the other chemicals in the smoke. And because of that, it leads some researchers to believe that menthol aids in increasing a user's nicotine addiction. And you can go ahead to the next slide. I'm going to hand this now over to Latricia to talk a little bit about the impact of menthol as far as who in our community is being specifically targeted. And you can go ahead to the next slide, and I will let
Commissioner Terrace has a question.
Yes, I'd like to ask you a quick question, Gwen. Did I understand you to say that 95% of the marketing for cigarette sales occurs in the retail environment?
95%, yes.
So are you saying that 95% of the money that the industry spends on marketing is right in the retail environment?
Yes, it's mostly pumped into the retail environment because of advertising in the stores and also billboards and signs that they can put near a retailer. So 95% of what they put in is in the retail environment.
Okay, thank you.
Okay. Well, good morning, Chair Harrington and board. If you could go back one slide. I just want to share first my appreciation for the work that Gwen and Houston have done, and for Director Kyle for allowing me the opportunity to speak in support of their work and to emphasize the inequities that are part of the public health impact of tobacco use in our country and the world. As a person who has worked at the intersection of health and equity for over 25 years, I very much appreciate the opportunity to contribute to the effort to promote health and save lives in Washington County. So the marketing of tobacco products, as has been discussed, is not uniform. The tobacco industry has, in their documents, shown that the industry tailors its marketing to specific demographic groups defined by race, ethnicity, income, mental health status, gender, and sexual orientation. So many of the communities that we, through our equity resolution, want to have a higher emphasis in promoting health and supporting their resilience, the tobacco industry targets for tobacco use. Framed as an issue of social and environmental justice, research has documented historical, racial, ethnic, and socioeconomic disparities in the presence of tobacco billboards, racial disparities in total tobacco marketing volume, and targeting of menthol cigarettes to communities with more Black residents. Targeted marketing of a consumer product that kills half of its users when used as directed exacerbates already existing inequities in morbidity or sickness and mortality, which is death. And that's about putting profit over health. So speaking specifically to the impact on the Latino community, cigarette brands such as Rio and Dorado have been heavily advertised and marketed to the Latino community, including advertisements in many Latino publications. And the tobacco industry extends their marketing to include things like funding for universities and colleges with high Latino enrollment and scholarship programs for the Latino community, as well as support for Latino political organizations, cultural events, and other community events. So we know that there is a heavy focus on targeting marketing towards the Latino community. Next slide. However, African Americans are most historically impacted by menthol cigarettes. And although African Americans usually smoke fewer cigarettes and start smoking cigarettes later, they are more likely to die from smoking related diseases than white Americans. Again, the tobacco industry extends its marketing through cultural events focused on the African American and Black community, also with contributions to education institutions and civic and community organizations that serve the Black community. And there is a documented history of more advertising in African American publications. And so just a real concerted effort to get African Americans to start smoking with a focus on menthol. So we can see nationally, African Americans who smoke use menthol nearly 3 times as often as people as whites and other communities who smoke. And the disproportionate impact also shows up in the LGBTQ population, again, with that targeted marketing for events that we support from a health and community building standpoint, like Pride. The tobacco industry is also engaging in promoting their products there as well. And next slide. So this slide just demonstrates that, similar to national data in Oregon, African Americans who smoke are also disproportionately using menthol cigarettes. And so African Americans who are engaged in health equity work also very much are focused in on the importance of making it harder for youth to start smoking by creating that distance, particularly with menthol cigarettes. And I'll turn it back over at this point to Gwen.
Okay, I tried something. Is this mic better?
Yes.
Yes. Okay, great. Thank you. So what do we know? Economic research has shown that the impact of flavor restrictions to retailers would be relatively narrow. According to data from the U.S. Department of Commerce, in 2016, only 18% of profits were from tobacco. In comparison, prepared foods were 35% of profits, and packaged beverages were 19% of profits. So I'm going to take you through some as we get going through the next couple slides, I'll be taking you through some examples that I have found in other jurisdictions that have implemented something similar when it comes to restricting flavors, including menthol, to give you an idea of what that retail landscape looks like. So for example, when retailers in Boston, Massachusetts were asked what was done with shelf space after their policy was implemented, over 70% indicated that they replaced the flavored products with just non-flavored tobacco products. And 13% said they replaced it with non-tobacco products altogether, so went with something totally different. 7% said they just didn't even fill the shelves back. They just kind of stocked maybe more of the same thing that they already had there. And then the remaining listed just something completely different. So this particular case study in Minnesota was the first one that I have seen that actually did, the only one that I've seen that did an economic impact analysis when they were looking at a menthol ban in particular. So the profit loss was $1,519 for menthol profit. Their tobacco total profit was $6,253. So this wasn't as astronomical as maybe could be feared when you take these products away. That was the actual profit loss to the store. So the main takeaway on this is that the estimated cost to the retailer is small in comparison to the cost to community and individual health. And just to put that in comparison, so this a store would lose maybe $1,519 in this particular study. In 2019, Washington County spent $215.9 million on tobacco-related medical expenses. So I just want to put that into context for you. So the research, again, is highlighting that most convenience stores actually make more money from selling the prepackaged foods and drinks than they do tobacco. Next slide, please. So results from the flavor restriction. So we're seeing that youth report less use, there's higher quit rates, and there's a national trend towards some type of flavor restriction. So in 2009, the Tobacco Control Act gave the FDA the authority to regulate tobacco products. The law also prohibits the use of characterizing flavors in cigarettes, except for menthol. So menthol made it through that 2009 reiteration of how they were going to market these things. A study using data from the National Survey on Drug Use and Health found the flavored cigarette ban. So this is when they took flavors out of other cigarettes back then, and they just kept menthol. So all the other flavors in cigarettes went away, but menthol. They did find that ban associated with a 43% decline in smoking among youth ages 12 to 17 and a 27% decline in smoking among young adults age 18 to 25. So next slide. So this is a map. It's a map that shows you currently there's 310 localities that have placed some type of restriction on flavored tobacco products. So this just kind of shows where they all are clustering. In November 2019, Massachusetts became the first state to restrict the sale of all flavored tobacco products, and they included menthol cigarettes. And then in 2020, New Jersey, New York, and Rhode Island enacted bans on the sale of flavored e-cigarettes. And California became the second state to prohibit the sale of both flavored e-cigarettes and menthol cigarettes. So all those tiny flags are really the individual cities that or counties that enacted some sort of flavor restriction. And then eventually that drove the whole state to move in that direction. So data from the New York City Youth Risk Behavior Surveillance System, they went to look at what happened when they did a flavor restriction back in 2013. And they found that they had there was a 37% lower odds of youth saying they ever would try a flavored tobacco product, and 28% lower odds of ever using tobacco in general from teens that answered it in 2010. So they saw a huge decrease in youth reporting even trying these products when their flavor restrictions went in. The percent of New York teens who reported ever use of flavored tobacco products or use of any tobacco products, that declined significantly after that policy was implemented. So in Providence, Rhode Island, use of any tobacco products by youth decreased from 22% in 2016 to just 12% in 2018. So about a 10% decrease there. And then in San Francisco, researchers found that among 18 to 24-year-olds, the prevalence of flavored tobacco use decreased from 81% to 69%. And then our neighbors to the north, Canada, in October of 2017, banned menthol cigarettes nationwide. A one-year follow-up survey found that both daily and occasional menthol smokers were more likely to report having quit smoking or having made a quit attempt than compared to non-menthol smokers. So if we look specifically at menthol, research has shown that if menthol cigarettes were banned, 39% of all menthol smokers and 45% of African-American menthol smokers reported that they would try to quit. And among young adult menthol smokers, so that 18 to 24, 65% reported that they would quit smoking and not use any other products if menthol cigarettes were banned. And if a menthol cigarette ban had gone into effect back when they were discussing all of this back in 2009, even 2011, researchers estimate that more than 320,000 smoking attributable deaths would be averted by 2050, and almost a third of them would be African American. So we can see how menthol plays a huge role in this. Next slide, please. So where we're at today. So Ordinance 878, the proposed county ordinance for access to minors. So this is what the ordinance we've proposed will do. There would be no change to purchase sites for non-flavored tobacco products for over 21. So that's your vape shops, liquor stores, tobacco warehouse, any place that already serves 21 and over patrons would continue to be able to sell these products. We would be adding vape and synthetic nicotine to the definition. We'd reflect the legal purchasing age of 21 and updated definitions. We'd restrict all flavored tobacco products. So this includes all the fruity, menthol, all of it, to establishments with only traditional tobacco products. And it would only leave traditional tobacco products on the floor in a convenience store or grocery store. So the regular flavor of tobacco itself. And price promotions and discounts would be prohibited in all establishments that are selling tobacco and vape products. Okay, next slide. There's also been a proposed amendment by Commissioner Fye, and we wanted to draw that out too. So this would be a complete ban on all tobacco flavors. And this includes flavored synthetic nicotine. We're including synthetic nicotine separate because it is not a tobacco derived from the tobacco plant. It's derived in a lab situation, but we wanted to make sure it's included because it is starting to grow in popularity, especially among youth. So this would be a complete ban on all the tobacco flavors, including synthetic nicotine, from all retail locations in Washington County. So this would eliminate completely the sales of all flavored tobacco products. It would eliminate completely advertising and promotion of all flavored products from what we see in our communities. It would add vape and synthetic nicotine to the definition, and then it would reflect the legal purchasing age of 21 with updated definitions. A complete flavor ban is a public health tobacco prevention best practice, as it reduces youth initiation and it does increase cessation attempts. Next slide, please. So our recommendation as public health is that we recommend the board consider adopting an ordinance that reflects best practices in tobacco prevention. Next slide. And board direction. So at the October 19th meeting, your board can vote to approve the ordinance, reject the ordinance, amend the ordinance, or continue. And then next slide is just if you have any remaining questions. Yes. Oh, you're on mute.
Mr. Carr, if we amend the ordinance, do we have to continue it for another meeting, or can we amend it and adopt it in the same meeting, October 19th?
You cannot. It's not continued. You amend it, and then it requires under the charter a third reading.
Right. That's what I wanted to make clear. That amending it means we can't take action. It doesn't finish it that night.
Yeah, the action you take would be to amend it, and then yes, you'd have to go for a third reading and another public hearing, a second
Yep.
public.
Yep.
I have a question, please. Mr. Carr, so if we move, we're talking about moving both the ordinance and the amendment to October 19th, which would give us time for public comment on the 19th. Is that correct?
Well, this is a work session, so you don't take any action today. You're just having a discussion today. At the 19th, someone will need, if you want to amend it, someone will need to move the amendment, and a majority of commissioners would need to vote in favor of the amendment. The ordinance would then be amended. It would not be adopted finally. It would then require another hearing at which the engrossed ordinance would be considered at a public hearing, and you could pass it then. If there's a majority vote to do so.
So the question that I'm really getting at is, does our public know? How do they know? I assume it's through through watching these types of work sessions that we're considering an amendment. I'm concerned about getting public comment about the amendment as well.
Absolutely. So that's the reason for the second public hearing. So at the first public hearing, you will hear testimony and comments. You will then decide, based on what you've heard and your own views, whether or not to vote in favor of an amendment. If you choose to amend it, then there'll be notice and another opportunity for the public to comment on the amended or engrossed ordinance.
Okay, thank you.
Yep. Welcome to the wonderful world of the legislative process, which is one reason why, as expressed in our prior meeting, when we had the second reading and first public hearing, and Commissioner Fye made a motion to amend the ordinance, there was a discussion of discomfort. And so she withdrew the amendment and provided us all with the opportunity to have that in writing. So it is included in today's packet, so that we all have the benefit of having it in advance of the October 19th meeting, at which time she is well within her right to once again make a motion to amend the ordinance. In addition, I asked Mr. Carr to let me know. I agree with all the components, or I agree with the intention of the proposed ordinance from Commissioner Fye. And I asked Mr. Carr about what draft legislation and findings would we need, in his opinion, to effectuate all those very same actions. And that's why I sent you all, and it was included in the work session update, a second version for amendment, which I believe achieves the very same outcome as what was enumerated on slide 19. Go ahead, Commissioner Willie.
I don't want to make this process any more complex, but Tom, so the 19th, the amendment is going to be proposed. And what if it fails? Then we go back to the original ordinance. Are we then able to pass that original ordinance and have no further public meetings on this?
Yes,
So it would be a done deal on the 19th if we don't amend it.
yes. So the process is, under Robert's rules, a member makes a motion to amend, it's seconded. There's a discussion and vote on the amendment. If the amendment fails, you go back to the original motion, which would be the motion to pass the ordinance.
So at what point in time, and is this the proper time and venue for us to have the conversation about the proposed amendment of banning these products? So is that today? Are we going to have that conversation?
Well, that's up to you. There's two things to consider. One, this is a work session, so you can talk about whatever you want. You can't take action. You're receiving no public comment. So you can discuss whatever you want today, and that's up to the will of the commissioners. At the hearing on October 19th, if there's a motion to amend, then that's also an appropriate time to have that discussion in the context of the public hearing and the public comment that you'll receive. So in my view, the more effective time to have it is in the context of the public hearing, although this is a work session and you can discuss anything you want.
Okay.
Are we having that discussion now? I mean, it's clear to me what the different options are, and is this not meeting your expectations, Commissioner Willie?
No, I was just asking for, the sideboards to this, so we stay in bounds, I guess. And I would like to have that conversation today. It seems kind of interesting that we're going to talk about an amendment to this ordinance that isn't officially even made until next week, but we know it's coming because there's already, 2 votes, so a motion and a second, so it's going to put it on there. So anyway, no, I'm more than willing to have the conversation today on both issues, whether we ban or whether we restrict to over 21. So I'm prepared to do that, but I'm waiting for, I guess, direction from both Tom and the chair.
So I have a question that may be more pertinent for this meeting. Given that all of this is in the public domain, that's why I have kept my conversations on this topic since we had that first reading, or the second reading and first public hearing to our public meeting. So my question is, Commissioner Fye, you had your list of proposed changes, and I don't know if you also included the findings or what the relationship is between your ordinance and the findings. But I'm wondering what your thoughts are on the amendment that Mr. Carr gave me on both the ordinance and the findings in order to reach the very same objectives that you have for your ordinance, for your amendment, but making sure that we have the complete list of changes as well as the findings to implement it. Have you had a chance to look at it?
Yeah, and we're still looking at it because I have not. There was only there was a cleaner version with just one change. Is that my understanding? We were able to call out one thing that was changed, but it was really a more clean version of the one I sent. It's a bit more confusing because the way I see it is just the strikes, but I guess when others see it, there's a blue color and a strike and all that. So I think what you sent is a cleaner version, and I had one question that I was going to check in with Tom, and then reply back.
Okay. Okay. The outcome I'm looking at is to have an amendment that you support and that our legal team also supports and includes the findings, so that we have not only the amendment to modify the ordinance, but also the findings needed to support it. So whether we take care of it here today or before the 19th, it doesn't matter. I just want to make sure that we end up with a amendment with findings that will achieve the objective.
Okay.
Which is later's fine.
I guess, would you prefer that I ask now, Chair Harrington?
No, I have no preference at all.
Okay. Okay. Yeah, I'll check with Tom.
Yeah. And I just wanted to add that I appreciate the more extensive presentation that we've received today from our HHS and HHS team and our Chief Equity Officer. I think it brings a lot of information to the fore about the use of flavored products by our youth, also menthol, as well as summarizes a lot of national available data, including, if I caught it right, from the Commerce Department on the slide of what we know. So there was certainly a lot of data going by that I heard, but I wasn't able to capture all of it. But it certainly made a compelling story to me that no matter if we amend this ordinance or not, if we pass this ordinance, it would help ensure a better experience for our youth as well as for people throughout our community, while also continuing to make the unflavored or allow the unflavored products to still be available for the adults to utilize. So I don't have any remaining questions. Commissioner Terrace, go right ahead.
I do have a question. Gwen, your slide that showed the map of the United States, that was strictly about bans. It wasn't, it didn't address the look that the original ordinance talked about with the sales in 21 and only establishments, correct?
Yeah, the map actually shows folks that did either a full ban with all flavored products, or they did a full ban with flavored but kept menthol. Okay. So these were complete bans.
Is there information available about how the original ordinance was proposed and whether or not how that looks nationwide?
Our restriction to 21 and only establishments. There are some places that have done it. I know there was some issues with it originating in California. We've cleaned that up in our language. It was a loophole that they had was when they did the restriction, they didn't specify that the entire establishment needed to be 21 and over. So we had stores making a 21 and over room within the store, and it kind of defeated that. So they've all switched. And everything I have seen has gone to a full, but I can do definitely a little more digging and find that for you.
What I'm asking, is there nationwide information about how frequently that type of ordinance has been enacted? That's what I'm asking. Not necessarily, not the effectiveness, but where it's occurred across the country, just like the ban. You showed where the ban has occurred.
I haven't seen that, but I could do a little more digging and see if I can come up with something.
I would just like to see that as well.
I can do some looking around and see what I can find.
Thank you.
I double checked my notes before ending the topic. And I have a question for you, Mr. Carr. In the Exhibit A, which I believe is the findings.
Yes.
There's a section 2.07 enforcement. The number may change, but the section is titled enforcement.
Yes.
Oh, it's the next one. I'm sorry. Civil infraction. Could you speak to the difference between the use of the word may and the use of the word shall?
Yeah, the way it's used there, Chair Harrington, is the first, in the first sentence, it uses the word may, which gives the officer discretion on whether or not to issue the ticket. The way it's used in the second sentence, the word shall, is the format of the citation. So that becomes mandatory.
And the reason that I'm asking is I think in the version that Commissioner Fye provided, that first may was a shall. And I'm curious about how are laws usually written? I mean, why would we want an officer to have discretion in making, in following through on an infraction or not? Or do we usually write laws and rules and requirements as may with the infraction element as the shall?
Well, Mr. Anderson's noted for me that is our normal enforcement language. And let me explain a little bit. In the criminal context, it has to be may. Because to write a criminal citation, an officer has to have discretion on whether or not to issue it, because the officer has to make an individualized finding of probable cause. In the civil context, that isn't perhaps necessary, although it's also helpful to have. Also, in my own experience, in having done this work for a while, the giving an officer an ability to educate is often more effective than just writing a ticket. A business can often take a ticket as a cost of doing business, especially when you look at the numbers of sales. An officer's ability to say, I'm not going to give you a ticket this time, and anybody who's been stopped for a speeding ticket and been given an opportunity not to get one often behaves better. So we like to trust our officers' discretion on whether or not to issue the ticket. So I don't generally recommend making ticketing mandatory.
Thank you for helping me confirm my understanding of that. That was the only difference between the version that you supplied to me, given the common objectives versus what Commissioner Fye's version was. So thank you. I'm all set on that. Are there any other? Go ahead, Commissioner Willie.
Well, yeah, this is definitely a slippery slope, because it may appear that my opposition to both the ban and the limiting the sales to over 21 stores would mean that I am supportive of tobacco usage, and I am not. What I have concerns about is in regards to the ban. Two parts. One is this is only a county ban, so we are pushing basically the users who are going to acquire these products to surrounding counties. It's not a statewide ban, as my conversation with the American Cancer Society and others, that I would be more than willing to help them get a statewide initiative to reduce the marketing, to do whatever it is that needs to be done to reduce the sales and the opportunity especially for our kids under 21 to use this. And so I think it's inappropriate that we would, I don't think it's in our purview actually as a county to do this. Sure, we can, but should we? So that being a part of it. And the other part is that, Gwen, you gave a lot of information there, a lot of detail. I'm going to have to probably go back and listen to that again, because I'm assuming a good portion of that information you don't have written down, because it sounds like you've got everything right at top of mind and you're into this. And so you did a very good job of presenting it, but there was a lot of data in there, and data that in my research, sometimes the data is convoluted. So we talk about national statistics, or we talk about, I'd love to have statewide information be the only focus, or at least be able to compare it to nationwide. But everything gets kind of all balled together. But anyway, I digress. I'm sorry. I keep hearing in all the presentations that the culprit is the tobacco industry's ability to market these, and their focus on marketing these products, specifically menthol cigarettes, but overall flavored products, to our African-American environment, Hispanic, and they tailored their marketing to specifically those groups of people. And you think, well, okay, that's what marketing is. So they do a very good job of marketing that. So why don't we restrict that? Why don't we go after their ability to do those kinds of things, rather than, in this case of a ban, removing the product from those over 21, and certainly taking away their ability to make their own decisions. We should be marketing to them the dangers of tobacco usage, the danger of cancer, the dangers of addiction to flavored products, all kinds of things. Why are we not taking that approach? Why are we saying, nope, we're smarter than everybody else. We're just going to remove the capability of you getting this product, or make it very difficult for you to do that, so you have to go somewhere else. And I guess the stupid analogy that we all hear, that because we are in government, we are in politics, trust me, we're the government and we're here to help. I don't think that's the case. I think we're taking away the rights of people over 21 to choose. And I think that's my biggest issue with this. It smacks of prohibition. We all know about way back when. That didn't work so well. But this is really different. I get that. So I'm really opposed to the ban. Now, if we want to talk about limiting the sales to over 21 stores and those kinds of things, that's a different conversation to me. And all of my research that I did certainly differentiates between those two topics. And I'll be glad to have that conversation next week when we talk about this. But the first thing we obviously have to do is decide, and we're going to do that next week, decide if we're going to pass the ban or not. So that's my opposition to the ban, and I'll stop there, because it gets much wider. But Gwen, again, I'm assuming all of that information come off your head, so I just need to go back and listen to the presentation and take notes, right? Because you don't have that written.
I do have it written, so I can email you, if that's helpful, those key to everyone, the data that I had, that I just kind of ran through. I'm happy to send that along.
Because I think it concerns me mostly that you said it's just $1,500 per month, and that was in Minnesota. We don't know what Oregon looks like. But even if it was, you cited 18% of profits. They would lose 18% of profits. If we took away 18% of your pay, would you think that was okay?
It wasn't 18% of the total profits. It's 18% tobacco. All of it is what they sell. So that 1,500 was the menthol, specifically the menthol piece. So the total was 6,000. I'd have to look it up again, something. So they're still making, so from that 6,000 profit, they deduced 1,500 is what they did in that impact analysis. But 18% is what all the tobacco. So a lot of the other retailers just put more of the plain flavored, for lack of a better word, tobacco, and filled their shelves with that to take up the space.
Mm-hmm. Okay. Still, to me, and the other statistic I have is that, and this came from the Cancer Action Network, and it says there are just 233 retailers in Washington County. I don't think 233 stores is just. I think it's a pretty significant. What we don't talk about is how many of those stores are owned by small minority business owners. We heard from the Korean contingency last week, pretty significant number of those folks. And if we are, and that doesn't even take into consideration the number of employees that those stores all have. So if they have 10 employees, that's 2,300 individuals we're impacting. And if we, and 10 is probably too small, but I just think that this is very broad, and we're not taking into consideration the impact. We can't minimize what the convenience stores say. It's a 30 or 40% reduction in sales, not profits, just sales, because of the other items that are acquired in there. Okay, maybe that's a big number, but still we are messing with people's lives financially, as well as we're trying to fix a health thing that I think we can do differently. So to me, I think we're going about this in the wrong way. So I'll stop here.
Chair Harrington, can I just ask that Gwen be excused so she can go to her other meeting that she needs to go to?
I didn't realize we needed to do that because Marnie said that she would be leaving. So,
and I can do my best to answer questions. So I did have a follow-up if this was an okay time. Chair.
It's an open discussion. Go for it.
Okay, so I wanted to let Commissioner Willie know that Gwen's she's put citations in all of the slides, and then she's also going to copy and paste it and send it to you, her comments and notes. The other thing is I just wanted for our public to be clear when we were talking about citations and we were talking about officers, that it's not police officers, that these are code enforcement, through the public health code enforcement program. So just to be clear that we're not going to be asking our police officers to spend time on this. And then the last comment I just wanted to share is that this is just a reminder that bans on flavored products and on the advertising is a best practice. There's no way that we can go up against the marketing machine of the tobacco industry and try to have an impact. They spend billions of dollars on marketing and really targeting our communities of color and vulnerable populations. So there's absolutely no evidence. There's no way that we have the resources to go up against that. So that's why bans are the best practice based on the research.
Commissioner Rogers, the floor is yours.
Thank you. I just had a few questions, maybe, and a comment about the presentation. I like Commissioner Willie, have some significant issues, and it's very conflicting to me because I don't think there's one person I'm looking at on this screen who opposes tobacco more than I do. I lost a mother to it, so I've never been a smoker, not a smoker, and don't have any tolerance. But having said all of that, there are some issues, and that has to do with those of us who are on border counties. It's very easy to get products across borders, so we're really hurting a lot of retailers. I would very much support a ban statewide. I think that would be great. Nationwide, if we could get it, I think that would be important. But getting to the questions, Tom or Marnie, you might be able to answer this. My understanding, we can't prohibit the possession or use of this product. And so, if you can possess it or you can use it, you can go across county lines pretty easy, or you can go to reservation land. Native Americans have shops, obviously, as well. Across state lines, we're not far from that. And so if that's the case, and we have a problem to the presentation that we have, that $1,500, to Commissioner Willie's point, I've looked at small shops who sell products, $1,500 a month. They're lucky to make $100,000, and that's if they're working 7 days a week. So that is 18% of what they take home. This is a huge impact, and that only looks at part of it because most of these vendors are selling other products. And that's why I don't want to hurt the vendors. I'd like to stop the practice, and I'd love it to be a statewide ban, but we may not want to flash that number because those who are in the business are going to look and say, this is a significant hit. And most small convenience stores are owned by minority owners, by the way, because it's easy access to, in a way of capital. They extend capital very differently in the lending market. My other concern is that somehow we're sending a message that we're either pro-tobacco or anti-tobacco, and I've yet to see anyone here who is pro-tobacco. We're anti-tobacco, and I'm not sure how we say that loudly enough, or how we message that, as Commissioner Terrace is famous for saying. What's the message we're sending out, and how is that being heard? I'd like to send a message: we're anti-tobacco, pro-retailer. How do we convince retailers to come about of maybe a statewide ban? How do they get on board for that? The last thing I had was, and maybe Tom can answer this one, is that what's the definition of sale? If I want to sell a Coke for $8 and give you a pack of menthol cigarettes, can I do that? I didn't sell it. I gave it to you. And if there's no regulation against possession or use, I can play lots of games by doing that. So is sale meaning that it's bundled in a product? But if I give it to you for free because you don't know I'm bundling it, or it's like that great commercial on TV now. You see the guy that the hybrid, he goes in and he says, I want to squeegee my window off. And he said, no, you got to buy gas to get the squeegee. So it gives him 50 cents and gets to use a squeegee. Can you bundle products so that we're going to be right back into the situation again? So do you know that, Tom?
We could define it to include that, but the state law prohibits the distribution of free tobacco products to anyone under 21 or any premises where someone under 21 can be. So it would only affect adults. So your plan would be illegal under state law for most of them.
It's not my plan. I don't want to do it. I'd like to cut it.
Okay, sorry. So the plan that you hypothesize, Commissioner Rogers, would be illegal under state law. Your first question is a much harder one, and I was just quickly scrolling through state law to see whether or not there's a preemption on local prohibition on tobacco sales. And that's going to take a little bit more analysis or possession. There are, of course, as you know, challenges with any law against possession because you have to be intrusive. Prohibiting sale is a lot easier to enforce than prohibiting possession. So that would be a different sort of regulation. And I'm going to need a little bit more time to read through all of the Oregon law to see whether or not the state has preempted the field such that a county cannot prohibit possession.
Thank you. If you'd find that out, I'm about a 9-iron shot from the county border. For Jerry Willie, for me, it's about 3 driver lengths away, but so it's not that far. And there are tobacco stores right on the other side of the road. And so I'm trying to understand, can you simply just, as we said, go across, buy your product, come back, possess them, use them, and all we've done is shift the issue, I guess. We made a statement, and I'm all for the statement. I like that, but I don't know what I've accomplished. So anyway, that's all I have. Thank you.
Commissioner Terrace.
Thank you, Chair. There's been discussion here about statewide bans. Marty, can you provide information about how the bans in, I believe, Massachusetts, New York, California came about? Did they start with local bans? I mean, that would be my guess, but yeah. I just want to highlight that as well.
Thank you, Commissioner Terrace. My understanding, at least in California, is that they did start with local counties or community cities, and then it became a statewide ban. So to me, it's very similar to what we did with the drug take back, where we considered a local county ordinance, because once you start doing it county by county, then it becomes better to just have a statewide ban, and that's typically kind of the process that happens. I'm not sure about the other states. I can follow up, have Gwen follow up with you on that question.
Thank you.
Sure, yeah.
All right, are there any other commissioner comments or questions? Go ahead, Commissioner Fye.
Thank you, Chair Harrington. I wanted also to extend my gratitude and thanks to the staff, Marnie and Gwen and Latricia, for doing a best practice presentation in terms of this topic. This is a really hard conversation, and I think you all did what experts in this subject should do, and I really appreciated presenting, nationwide data and what others are doing, and then talking about the impacts it has on people. And I think this ban, it's about protecting youth, and youth are most likely not going to travel to another county to buy cigarettes, and also this really makes it hard for youth to get it from an older person, and then also likely of the youth standing outside a convenience store and getting the tobacco. So it's really all about protecting youth. And the other thing I wanted to say earlier about the conversation about profits over people or vice versa, one thing that we know for sure is that tobacco kills. Losing profit doesn't kill. And I think that's something that we really have to sit with and recognize, that we really are in this position to protect people and to center our values. And I recommend that we value people. This is, I think the counties are always the ones. I think one thing I learned in my short term as an elected is that the conversation about the whole pandemic, there was a lot of conversations when Governor enacted some policies, how county government, counties and local government were saying, this is why we are elected, to make decisions for our people. Don't tell us what to do. We're going to do what our people want. And I think we have an opportunity to, put that into work with this. And it's normal that counties lead states, and eventually we'll get there. And I think this is really, we're charting a new path for Oregon, and I really appreciate for Washington County putting our necks out there to say we're going to do complete ban and we're going to center youth and protect the people of Washington County. So thank you, staff, and I look forward to the conversations on the 19th. And Tom, I'll get back to you. I just had one minor question about entity versus persons, and that's all.
Wonderful. Thank you to staff. I'd like to include in that gratitude also to our legal team, particularly Brad Anderson and Mr. Carr, for helping us explore this space. You put it well, Commissioner Fye, in terms of gratitude for best practice approach and our local public health authority. And as Commissioner Terrace also touched on, needing counties and cities to lead for the betterment of the community. I think we've had some good discussion here today and perspectives, and I look forward to our having more and hearing more at our meeting on October 19th. So thank you.
Can I add one thing? I forgot to. I'm sorry, my yellow raised hand matches with my background. I realized that. I was gonna, Commissioner Rogers mentioned about being a pro retailers and really helping the retailers. And I was wondering, is there an opportunity for Matt, our economic development manager, to work with the retailers to develop some healthy strategies around how to build their business with this potential anticipated loss, if there is any? So I think there's an opportunity to help the retailers in that way to mitigate the smaller financial loss that we're anticipating.
Well, without further ado, I think we're all set on this topic today. So I would suggest, given that it is 10:21, that we take our 15-minute break now and pick back up with topic number 3. Okay?
What time are we returning?
In 15 minutes. How about 10:35? Okay, see you later. Okay, folks, it's 10:35 according to the network. So we'll pick back up on topic number 3, Garbage and Recycling Advisory Committee member appointments. Hello, Tom Eggleston.
Good morning, Chair Harrington, Commissioners. I have my colleague Kathy Folsom with me here today, and we are here to seek your guidance on appointments for 3 public member positions on the Garbage and Recycling Advisory Committee. As you may recall, earlier this year, your board approved updated bylaws and code language regarding the Garbage and Recycling Advisory Committee. Updated bylaws were developed to ensure the committee will seek to represent the whole community. The bylaws state that 8 public members on the committee should strive to represent members of or be members of historically marginalized communities, the disability community, aging community, students, those that live in single-family homes, those that live in multifamily homes, those from the nonprofit or governmental sector, master recyclers, those interested in the environment and advocacy, and among others. Following the adoption of these bylaws, the Solid Waste and Recycling Division began advertising vacancies for the committee and received 11 applications for 3 vacant positions. Kathy will now provide an overview of staff's applicant review and recommendations for your appointment.
Good morning, Chair Harrington and Commissioners. My name is Kathy Folsom. I'm a Senior Policy Coordinator with the Solid Waste and Recycling Division. As Tom noted, we feel that we've been very successful with our recruitment. Staff reviewed each application and held an informational meeting with the applicants. Solid Waste and Recycling staff are proposing that 3 applicants be considered for appointment to the Garbage and Recycling Advisory Committee open public member positions. Each of the proposed appointments represents many of the characteristics that Tom noted in the committee bylaws. Our first candidate for your consideration is Peter Pasteurs. Pete lives in unincorporated Washington County, and for the past 8 years, he has worked for the Department of Environmental Quality and their Materials Management Program. Pete has over 40 years of work experience in waste prevention, recycling, and toxics reduction. He's very excited about the possibilities that the new Plastic Pollution and Recycling Modernization Act's implementation will bring to the county. Pete identifies as white and male. Our next candidate is Hannah Carlson. Hannah lives in a multifamily community, and she is a student at Portland State University seeking a master's degree in public administration. Hannah is also a master recycler, and she currently works for PSU's Community Environmental Services, which is a research and technical assistance unit that helps fulfill the mission of waste reduction and community improvement. Hannah identifies as white and female and identifies as a member of the LGBTQ community. Our third and final candidate for your consideration is Myra Hernandez. Myra is a master recycler. She's very passionate about helping those who don't understand how the garbage and recycling system works. Myra currently coordinates a program for health and nutrition and facilitates a class for the Latino community. She volunteers with the garbage and recycling program in Washington County, and she identifies as Hispanic, Latino, or Spanish and female. Each of the applicants would serve approximately a 4-year term with the option to serve an additional 4 years. And if appointed, our Garbage and Recycling Advisory Committee community members will now be 25% people of color and 63% women. Thank you.
Thank you, Kathy. I know I have a question. If I could start. When I read the packet material, I was a little concerned about possibly appointing Peter Pasteurs, if I've pronounced his last name correctly. Thank you. Because of what we do have in the packet, so Tom, I appreciate the information that both you and Kathy have presented here. Given that Peter works for the Department of Environmental Quality with the Materials Management Program, isn't that the same department that would review our plans for compliance? So that's where I'm wondering, I hear the description of the bylaws saying that we support the nonprofit and governmental sector representatives from participating on the committee, but it feels like we're asking the regulating department to participate on the committee that's helping to advance solutions and advisement to us. So can you enlighten me a little bit more?
Yeah, sure. Thank you, Chair Harrington. That's a really good question. So we did talk with Pete Pastors about this because we had the same, similar concerns in the beginning. Pete mentioned that he had a thorough conversation with the state ethics department to kind of understand any potential or direct conflicts of interest he might have in serving on the committee. Pete works in the hazardous waste division. Hazardous waste is actually managed by Metro in the Metro region, so he has no directional oversight over the Waste Reduction or Opportunity to Recycle Act plans implemented by the county. The one area that there was a little bit of concern about was rate setting. As a member or community member of unincorporated Washington County, he would be eligible to take action on recommendations for rates, but that is an inherent role of the advisory committee, and all members that live in unincorporated Washington County are expected to or can participate in those votes as well. So thank you for that question. That's a really good question.
That information really helped me. Thank you. And I would also like to suggest, Ms. Angie, that Tom articulated what the bylaws say. I read what was supplied via the packet. I think it would really help for future committee appointments to either include a link to where the bylaws are available, or to put that brief description into the packet as well. So it just helps propagate that base information really well. So thank you for addressing my question. I'm comfortable now. Any other commissioner questions or thoughts on the appointment for this committee? Nope, I think we're all set then.
Thank you very much. We'll be back in 2 weeks. Bye-bye.
Keep up the good work. All right, next we'll move to the appointments to the Rural Roads and Urban Roads Maintenance District committees, as well as the Rainbow Lane Committee. Do we have Stephen Roberts and Todd Watkins?
Good morning, Chair. I think Todd Watkins is going to join us, our Operations and Maintenance Manager, as well as Sherry McFall, who's our Community Programs Coordinator in the Operations and Maintenance Division. So we're here before you. We actually have 3 appointments that we're seeking direction on. So the first is the Rural Roads Operations and Maintenance Advisory Committee, ROMAC. Second is the Urban Road Maintenance District Advisory Committee, URMDAC. And the third is a unique, I think one of a kind, it's called the Rainbow Lane Special Road District Board. And so with that, I will ask Todd and Sherry to walk us through the recommendations.
Hey, good morning, Commissioners. Todd Watkins, Road Operations Division Manager for LUT. And as Stephen pointed out, we have 3 committees that we'll be talking about today. The first 2 are actually advisory committees to the board. That is the ROMAC, Rural Roads Operations and Maintenance Advisory Committee, and then the Urban Road Maintenance District Advisory Committee as well. The Rainbow Lane Special Road District is not an advisory board. They are an oversight board for a special road district, but you do perform the act of appointing committee members to that advisory board, but there's no reporting to the board for them. Next slide, please. So with the 3 boards, this membership summary will illustrate what we have to work with as far as membership. ROMAC is the acronym we use for our Rural Roads Committee, and it currently has 12 positions that are established within the bylaws. And at the end of the year, we're going to actually have 6 vacancies. And for all these committees, by the way, we only have 1 applicant per committee. However, if any additional applicants do arrive during the course of the remainder of the year or after the first of the year, we will certainly consider them for addition to the committees. But currently, we only have 1 for each one. URMDAC currently has a 10 member committee. and there were only 2 vacancies at the end of the year. And then Rainbow Lane it's a 3-member board, and they actually are on a unique schedule where they are on 3-year terms. And so one person rotates every 3 years. So we always have 1 vacancy, and then they promote their own replacement candidates as needed. Next slide, please. So with this committee's appointments, we have ROMAC with Slade Leahy, RMDAC is Fred Barden, and then for Rainbow Lane, we have Jeremy Crace. Jeremy Crace is an existing member, and we will be requesting that he be reappointed to a 3-year term. For Slade Leahy, he is a new applicant. He is actually involved with a local construction company, so he has quite a bit of experience with road construction. He does have a degree in economics, and so he'll bring a unique perspective to ROMAC as well. Fred Barden is retired, and he's active in the Claremont community, being involved with some local committees there. And he has a lot of advocacy that he is looking to impart when it comes to pedestrian accessibility and through safety in the Claremont, West Union, Bethany area. All of those terms that you can see there on the screen will expire on the December of 2025 for RMDAC and ROMAC, and then for Rainbow Lane, again, as I mentioned, it's a 3-year term. The next slide, please. We do have our community programs coordinator, Sharon McFall, and she is the coordinator for the 2 advisory committees. And so any additional information can be forwarded to her if needed. We will be coming back to the board in the future for formal adoption and appointment of these positions. But if there's any questions that you have at this time, we'll be more than happy to answer them.
Commissioners, any questions on these recommendations for appointments? Nope. I think we're all set, Todd and Sherry.
Wonderful. Thank you.
Thanks for the good work. Keep it up.
Thank you all.
All righty. So, Mr. Roberts, thank you for staying with us for the next topic, the Washington County Transit Study.
Thank you, Madam Chair. I was a little too quick to turn off my camera. Thank you. I'm actually going to just introduce Chris Steffenbach, who's our Senior Policy Analyst. Chris is going to run us through an overview of the transit study, and then Diami Valentine's actually going to walk through the bulk of the presentation. So I will let Chris introduce herself and Diami, and we'll go from there.
Yes, thank you, Stephen. Yes, Chris Steffenbach. Good morning, Chair and Commissioners. What I'm going to do is introduce Diami Valentine and remind you a little bit about the Washington County Transit Study. We are very pleased to be able to share our approach to you today in anticipation of the intergovernmental agreements that you will be asked to approve for funding from our different partners for this study. So as you saw in previous presentations, this study is one of several that we have going on in the county now. So we have a lot of activity going on around transit, and it's really going to be beneficial in many ways to be doing these together. So you will remember that the proposal to conduct this study has been in the work program for several years, and it has been delayed due to staff capacity. But we really, not that we have tons more new staff now, but the need has continued to increase, and it is a partner endeavor, and our cities have funding ready that they're ready to contribute. So it really is a good time to move forward with this now. It is going to be particularly helpful to inform our priorities that we will need to be identifying in the next update for the statewide transportation improvement program, to get a better handle on the needs for those first last mile shuttles and how to set priorities for those. It'll be also really helpful as the region moves forward with allocating funding for what we call enhanced transit improvements, which are those projects that help the buses move faster on the streets, and to really get a better understanding about what the countywide priorities for that would be, as well as revisiting service assumptions. TriMet service enhancement plans are now a little dated. There's been a lot more development. And last time around, TriMet staff met with each city individually to get their perspectives on the service enhancement plans. By coming together, we'll be able to provide a stronger voice. And I think that is one thing we have learned is the need to help better articulate the needs in Washington County for transit. So for all those reasons, Giami's been working with our partners to work on a scope of work and an approach. So I'm going to turn it over to him to walk through this and answer questions, see what might be missing, make sure that you understand what the purpose of this is in our approach. So I'll turn it to Giami.
Great, thanks, Chris. My name is Giami Valentine. I'm a senior transportation planner with the department. And thanks for taking the time, Chair and Commissioners. Next slide, please. So this effort, as Chris noted, so the purpose of today, we're going to provide an overview of the study and an opportunity for you to ask questions and review the proposed guidelines, principles in advance of entering into our funding agreements with our partners. Next slide. So this effort is identified as a priority in the long-range planning work program for this upcoming fiscal year. The Washington County Transit Study will build on the success of prior planning efforts, which include Washington County's Transportation Futures Study, the Transit Development Plan, and First and Last Mile Transit Strategy, as well as SMART's Transit Master Plan and TriMet's Service Enhancement Plans. This also responds to the counties and regional goals and public requests for additional transit service to support the continued growth envisioned by our communities. And the study will afford us an opportunity to establish a collective position on transit priorities and help position the county to leverage partnerships with regional transit agencies to enhance the existing transit system. Next slide, please. So the study will seek to inform funding and service enhancement opportunities, including the statewide transportation improvement fund. Will also help to identify costs and benefits to improve transit speed and reliability in areas of increasing congestion on arterials. It will help to inform other efforts and specifically regional transit strategy and system expansion policies in the regional transportation plan, as well as transit provider plans, including TriMet's service enhancement plans. And it will also help inform local transit supportive programs and land use policies to support growing ridership. Next slide, please. So the county is joined by the cities of Beaverton, Hillsborough, and Tigard, as well as Tualatin, in helping to fund the study. Your board will be asked to approve the funding through intergovernmental agreements in November. TriMet and statewide transportation improvement funds will also support this effort. The partner agencies that are committing funding will provide and comprise a steering committee to oversee the study. We will also engage with cities and agencies through technical work groups, as well as the Washington County Coordinating Committee and its Transportation Advisory Committee. Next slide. So several factors really highlight the importance of developing a countywide position on transit at this time, which include establishing a collective position on transit priorities to meet Washington County's goals to increase the share of trips made by transit and accommodate the significant population and employment growth expected in the next 20 years. The outcome will help position the county and cities to leverage partnerships with transit providers to enhance the existing transit system by developing program and project recommendations to improve transit service and increase ridership. Next slide. I'm now going to walk through a set of draft objectives to guide the development of the transit study. The first of which is really to establish a bold vision that makes transit a viable travel option for all people living, working, and visiting Washington County, as well as determine where and how transit investments can deliver the greatest degree of seamless, integrated, affordable, safe, and accessible mobility for all populations. Next slide. We will engage and center our community using an equity framework consistent with other transportation planning efforts, with a special focus on inclusion of historically excluded communities and setting the priorities for transit service and capital improvements. Next slide. I also incorporate, as Chris kind of walked you through a couple months ago, other ongoing efforts. We will incorporate and leverage these efforts underway to use the region's limited resources as efficiently and effectively as possible. Next slide. We also hope to identify partnership opportunities to further extend transit service and infrastructure, as well as develop measures of effectiveness to evaluate transit investments and to track progress over time. Next slide. So the study will comprise 3 major elements, and each of these elements are intended to inform and be informed by the overall process. So the approach is to explore different strategies to support transit, including the implementation of transportation demand management and parking programs to facilitate improved access to transit. The result of this, the policy element will help identify potential land use and transportation policies for consideration at the city and county level. The service element will explore existing and future market conditions that influence transit performance in Washington County. And the outcome of this effort will be the identification of transit service priorities and recommendations, including new service models like express bus and last mile shuttle to inform service providers' enhancement plan updates, as well as the county's transit development plan. And the capital element is focused on identifying strategies to improve access, as well as the efficient, reliable delivery of transit. And the result of this will help inform requests for and access to regional funding, as well as informing our local capital improvement programs. Next slide. So this figure illustrates the anticipated community conversation, as well as the decision-making process. And the community engagement will provide meaningful input at key milestones and take the form of a number of means, including online and rider surveys, forums and focus workshops, whether in person or online. And as noted, we'll leverage other planning activities and look to partner with community and employer-based organizations to engage members. There will also be a project team, which will consist of county and funding partners with support from a consultant. And as I noted previously, we'll convene technical work groups consisting of staff from cities and agencies, as well as transit providers and county departments whose services may be impacted by the study outcomes throughout the process. We'll also provide briefings to the Washington County Coordinating Committee and its Transportation Advisory Committee. And we will seek input from the county's transit advisory committee, city councils, and your board are key decision points. And ultimately, it will be the transit providers that we will seek to have them incorporate the findings and recommendations into service enhancement plans. Next slide, please.
Can I ask a question on this slide, Chair Harrington, or do you want me to wait?
Go now.
Oh, thank you. Sorry about that. So I see community conversation here. Can you pull out where the community is? Well, you know, like I don't see any community members, and my definition of community might be different. So maybe we should start how we're defining community on this slide.
It's intended to be reflected in the larger arrow, so they're throughout the process. So that we certainly are focused on making sure that this is a community-centered as well as providing the resources and information to increase the capacity and advocacy within Washington County. And so it's not reflected in here, but we have a pretty long list of partners that we would seek to engage, including community-based organizations, West Side Transportation Alliance, our schools, Portland Community College, certainly engaging students, and other potential boards and advocacy groups, including like Aging and Veteran Services, who we've coordinated with on the transit development plan. And you know, we intend on utilizing kind of a similar approach that's being developed for the MISTIP program and leveraging that equity framework approach.
Aren't you also including the various tactics of the online and rider surveys, as well as the forums and workshops, such that if we as commissioners, if we have partners that we want to ensure are aware of this project and the participation opportunities, that we just need to get in touch with you and try to pull them in?
Yes, yeah.
So Commissioner Fye, if you have ideas, I just want to make sure that you feel connected and supported through our staff to make sure that folks that you have in mind or others who you would want our team to touch bases with are known, and those comments are welcome.
Yeah, thank you, Chair Harrington. I think what I'm looking at, you know, when I see this, I know there's definitely going to be community input, but they're sort of in the background and not centered and put forefront. And what I'm looking at is to put the community at the forefront in a way to respect getting feedback from the community and appreciating. While everybody that's listed on these brackets are policymakers and experts, how do we get that day to day, like, you know, on time, on that same day, lived experience, actual people who depend on transit, on their livelihood, to go to work, to go to the park, to go see family, to go to the church? How do we get that? And so I think what I'm looking at is to actually create one of these oranges or the gray bucket that centers that. And you know, it's not, I'm not looking for you to do extra work. I know your plate is full, but we don't have to recreate the wheel. There is a community-based organizations that we work with. And also we have, an equity focused department now that does solid community engagement. So I'm just wondering, how do we, with this process, how do we, appreciate the community and recognize at the forefront their level of involvement? Because we say community conversations, but they're in the background. But how do we bring them up to this level of people? The WCCC TAC or the technical work group or the project team. How do we, do they come before? Do they come? I don't really have an opinion on where they be put on, but I'm looking to create another one of these buckets that really just demonstrates, our level of appreciation, because they're going to be contributing significantly to this study.
In a way, I think it's just a matter of how it's represented, because, and I say this based upon my involvement with the transit development plan, and I was so impressed with how that lived experience, that day-to-day lived experience, was brought forward to the committee using these tactics and tools that Diami has represented here. So in a way, that gray arrow isn't actually in the background.
Mhm.
It's very much a major component, a major thread throughout all of this, and is the vital information that is brought forward in each and every one of these touch points, to make sure that it is brought in and is effectuated.
Yeah.
But I think you raise a good point, and let's try to make sure that the team has captured the need for that, and follow up and keep going. Does that sound reasonable? Okay.
Yep. Yeah, and I think our intention there was to really indicate that the community conversation was really going to be foundational to all of these other elements of the project, and so we'll definitely work on the imagery there. Thank you.
So here's, I appreciate that feedback. And so we're interested in making sure that the objectives that we've reflected here reflect the board's goals for the transit study, and make sure that we're addressing any kind of concerns in terms of the study approach. And if there's any additional information and or briefings that the board would find helpful, we'd be happy to provide those as well. So happy to take any questions at this time.
So commissioners, what do you think? Thumbs up, or any additional feedback, accommodation? Go ahead, Commissioner Willie.
Just one quick question, and I got to go back to the slide presentation. It was on slide 9, and Diami, it's just a oh, thank you. How do we have 1, 2, 3, 4, 5 different studies going on at the same time?
Yeah, good question.
Yeah.
I mean, can't we all get together and say, hey, let's do one humongous study here or something? I mean, there's got to be a lot of money spent on 5 different. I'm hoping these studies all talk to each other and have kind of some common goals in there. But anyway, I just saw that and thought, wow, that's a lot.
There are certainly a number of efforts underway, and there's a common thread through all of these that we will certainly be, working and aligning our efforts, because we do want to be efficient with everybody's resources. So,
Yeah.
Okay, thanks.
Thanks for noting that.
If I can add in too, is that, remember the Red Line Max Todd study, that's probably going to focus in on 185th baseline area. It's where they found the most opportunity, but that came from an FTA grant that TriMet applied for. So, and then the other one, the TV Highway, that was a FTA grant that Metro applied for. So some of this is just the timing of the way things that others have applied for grants. But this countywide transit study should really help inform the work going on TV Highway by looking at the whole network. So I think that will really be beneficial. Same thing for the West Side Multimodal Improvement Study. That's the US 26 study, corridor study. But the work in the countywide study should help inform where some of the markets are and some of the needs in that study. So there'll be a need for close coordination between all of these. Unfortunately, the same staff will be involved in all of them. So we should be able to work on that. And then just as the chair mentioned, the Washington County Transit Development Plan is one we need to update every 2 years. So this will also help us, particularly for those requests for first, last mile and other services that we then fold in to seek statewide transportation improvement funding for. So it is a lot, and that's why we came to you with this whole picture, because it's a little bit, it can be a little bit confusing, and we're going to do our best to help you keep it straight.
I can identify as one who needs that help keeping it straight. How many times did I say, now wait a second, I thought I participated in that plan. How is this different?
Yeah.
Yep. Well, I'd say, staff, you're doing a great job. Oh, go ahead, Commissioner Terrace.
Thank you. Tammy, could you go back to the slide with the arrow in the background? So, what I don't see, what I don't understand is where the Venn diagram comes in with TriMet itself.
Mm-hmm.
And, because we talk about all these things, but when it comes down to it, if we're talking about, the West Side Service Enhancement, that was driven by TriMet. I mean, we have a lot of input into that, I understand, but we still have areas where people don't have ridership opportunities. And, I'm thinking primarily about my district. And what I don't understand is I see this as our work, our local community, our staff, and, at the very end is the transit providers. But I don't understand how and when TriMet is involved in this process. Am I the only one who doesn't get that?
No, that's certainly helpful. I mean, we are. They've encouraged us, and they're excited by this opportunity because the service enhancement plans for the West Side and the Southwest are, they're a little dated, and they've already checked off a number of those priorities that they identified through those efforts, and so they are thinking at least in the next couple of years that they will revisit those plans, and so I think they see this as an opportunity to build from our work and in helping to identify some priorities. And TriMet is they're sprinkled through a number of these groups, so they're plugged in, even as a potential funding partner, as part of our steering committee and on technical work groups, and as well as kind of at ex officio on the Transit Advisory Committee, and then we would look to brief them throughout the process as well to make sure that they're in terms of leadership, to make sure that we're bringing them along through the process.
Okay, so they're kind of in the sausage making part right here. I mean, I get that. I guess what I didn't see is the coming together of the leadership piece in terms of when does that happen? So anyway, I appreciate your comments, and it just seemed like that was a piece for me that I need to understand.
I think for me, Commissioner Terrace, the reason why it seems clear to me is because I have 12 more years of experience being an elected official as TriMet has updated their transit investment plan through various cycles. I mean, going from the Great Recession where they had to reduce service to bringing it back online, and then the service enhancement plans coming in through a request for clarity of, so how are area businesses getting their return on investment for the payroll tax, right? And then the payroll tax is on a pattern for future increases as well. And so it's a natural cycle of pulling in plans for the betterment of the whole system. I mean, back with the 2010 Regional Transportation Plan, we had to do a whole high capacity transit plan for the whole region because the prior version was outdated because we had great success in building it, right? So it's certainly part of matter of timing and where we find ourselves from the local community, neighborhoods, all the way up through our counties, our region, and the state, so that as we move forward, our public can be assured that we are making requests for, the real hard part is the funding, right? That we're making requests for funding per plans that have been developed and vetted with our communities, and that we continue to enhance that. So it is very much a cyclical and a feedback loop. But it seems to work for our community and gets results over the course of time. So good job keeping up with it all, because you've participated on multiple transit planning committees, or not just transportation planning committees in the various capacity you've had through the course of your career as well. And the good news is we continue to get better and better.
And I guess I'm really trying to look at this through the eyes of the public that may be watching this. And so that's the nexus point between those two that I was thinking that it would be, if you didn't have the experience or even the degree of experience that some of us have had, it would be confusing. So.
Anything else, colleagues?
I have
good job, Steph. Oh, go ahead, Commissioner Fye. These noisy backgrounds, I can't see. Yellow hands, flash hands, sorry.
I'll just dance next time. I have a low lift question, and this I think is the first slide around the map, just to understand where, how far the project expands. And I believe in transparency, so I'll just ask in a more transparent way. I'm wondering the significance of unincorporated areas of Washington County this project will have, because some of the unincorporated areas, especially in District 1, have significant transportation safety concerns and a lot of unsafe routes to transit, bus stops and whatnot. So, is it mainly unincorporated focused, or just help me understand majority where we're going to start and where we're going to stop?
Yeah, good question. We are intending this to be fairly comprehensive. So countywide, reflecting, understanding that we have a lot of transit providers that connect to and through the county. So this will consider connections from rural to urban, urban unincorporated, as well as the incorporated cities inside the urban growth boundary.
And I would add to that, Commissioner, I think that's a great observation. So as the county, we sort of have a dual role in efforts like this, one of which is to advocate for our unincorporated parts of the community, but also then to be the countywide coordinator, so helping to ensure that we have a system that hopefully works throughout the county jurisdiction, whether you're in a city or whether you're in an unincorporated area. So we'll be doing some of both of those things as a part of this work.
And if I could just add, I think the transit routes go through all these communities. It's one of the things that does tie us together because a route will connect across the area. Yeah.
Staff, could you please wrap this topic up for us?
And I believe we're done, unless there are any other questions.
Great. I think that finishes our agenda for the morning portion of the meeting. We have a time certain return at 1 o'clock for our joint meeting with the Washington County Fair Board. Do commissioners have anything else, or does our leadership have anything else? Okay, seeing none, that's it then. We'll see you at 1 o'clock, folks. Bye-bye.